Are you hopeful to potentially see the future of medicine start to take a bit more of a first principles approach and start to think through the lens of uh, finding the root cause and diagnosing the root cause? Like, do you think that there's a path forward where there's more options for people to start to find functional medicine practitioners?
I I have a kind of mixed assessment. So on the one hand, I've been incredibly frustrated with how slow the changes have been. My second book was called Unconventional Medicine that I published in 2017, and it was a sort of manifesto addressing, highlighting a lot of the problems with the conventional medical system, specifically related to its how it falls short with chronic disease. I mean, I think the conventional medical system is pretty amazing when it comes to trauma and acute emergency medicine care. If I have an injury or I get in a car accident or something like that, it's pretty remarkable what conventional medicine is able to achieve. And there's been some phenomenal innovations, antibiotics and lots of other things that have significantly extended human lifespan. So I'm not arguing that it doesn't have a place, but it just has not really been helpful when it comes to treating chronic disease. And the problem with that is that now 7 of 10 deaths are caused by chronic disease today, which is very different than like in the early 1900s. Most people were dying from acute infectious diseases like tuberculosis and pneumonia. So we're in a different place now than we were even just 100 years ago, and we need different tools. But the progress has been very slow for the medical model to change and adapt in a way that is better suited to functional medicine or to chronic disease. On the other hand, there have been some very positive developments. So there's now a Cleveland Clinic Center for Functional Medicine. Cleveland Clinic is a pretty well-regarded international institution. And to have that like rubber stamp of approval, that they have a Center for Functional Medicine is a pretty big deal. And there are a whole bunch of startups over the past 10, 20 years that were all like Parsley Health and Steady MD and a bunch of other medical companies that are attempting to find ways of scaling functional medicine, or at least what I would call functional medicine light, which is maybe not the full service functional medicine that you would get if you came to see me or someone like Mark Hyman or any number of functional medicine clinicians, but they're at least incorporating aspects of the functional medicine model into their care, and they're trying to do it in a way that's accessible to a broader number of people. The fundamental challenge, guys, is that functional medicine by definition is highly individualized. And that means like we don't just apply the same treatment for the same disease in all cases. We will look at each patient individually, do testing, full history, and you might have two patients with ulcerative colitis who get totally different treatments
Mhm.
because the cause is different in each case and each person requires a different approach. That's a very difficult model to scale. And that's just true. Objectively speaking, it's just true. It's much harder to scale something like that and make it accessible to the number of people that we have in this country than a model that's predominantly based around pharmaceutical interventions that are not individualized, that are really actually directed to a condition, right? So what I mean is like if you have our model is like, okay, so the patient has diabetes, you do this, this, and this. Then you do that for all patients with diabetes. And of course, there's some individual variation there, but not a lot, right? That's easier to scale because how much time do you really need in an interaction with the patient to get to the point where you can prescribe metformin or something like that? 10 minutes, 15 minutes? You don't need an hour.
Right.
And that's what's going on. I guess what I would say is I understand and appreciate the complexity of it. and I don't know what the answer is, if I'm really honest. Like it's an intractable problem, and my book on conventional medicine proposed what I thought could be some answers for sure, but it's a really thorny and difficult systemic problem.